So emphysema is the other portion of COPD. Emphysema always reminds me of a whoopee cushion. If you've ever played with a whoopee cushion, you know that it's very easy to get air into the whoopee cushion, but to get air out, you really have to squeeze hard. So your alveoli become like little whoopee cushions. There's not necessarily a problem getting the oxygen, but getting rid of the CO2 becomes really difficult. So sometimes what we see with people who have emphysema are these huge chests because there's so much retention and they just can't get that CO2 out. Asthma is narrowing of the bronchi and bronchioles. It's usually related to a trigger. Most asthmatics have a trigger. It could be an allergy to something like dust or cats that causes those bronchioles to swell up, and then it makes it difficult for that gas exchange to happen. You can't really get the oxygen in that you need. You can't really get rid of the CO2 because the airway is so narrow. So some oxygen basics, something you always need to remember as a CNA is that oxygen is a medication. So you are not allowed to titrate it up or down unless you've had more training beyond just this class. That is something that could really hurt somebody if they overdose on it. It's possible to overdose on oxygen, especially somebody who has some of these chronic respiratory illnesses. But some forms of delivery for oxygen are a nasal cannula. That's probably the most common one that you will see. It's just a little plastic tube that goes into the nostrils to deliver a higher concentration of oxygen than the person would get if they were just breathing on their own. There's also intubation. So if somebody is having a hard time breathing, it could be for so many different reasons. They could be really, really sick. They could be in a coma, really injured. Maybe they need to go to surgery. We have to put an artificial airway in. And this is a temporary situation. They're not going to have that plastic tube down their throat for a long period of time. But this is so that we know that the oxygen being delivered is going straight into the lungs. So it also, if they're put on a ventilator, it will help inspiration and expiration if somebody's in a coma, even if it's an induced coma. A long-term solution to that, if there's something wrong with the airway, is to create tracheostomy. So ostomy just means opening in the skin. So a tracheostomy would be an opening into the trachea. So the person will have a little stoma right there in the lower portion of their throat, and they could have oxygen directly attached to that stoma, or they might just have an open airway there to help them breathe. So cardiovascular system, there are several problems that can happen there, so we're only going to touch on 3 of those. So coronary artery disease is very common in the United States. This is when the coronary arteries become narrow and blocked as a result of atherosclerosis. So atherosclerosis, sometimes you'll hear it referred to as hardening of the arteries. So what happens over time, especially if somebody's got high blood pressure and diabetes that they're not taking care of, the arteries become damaged and they become scarred. So instead of having these nice, slippery, pliable arteries that blood can easily travel through, you have these hard arteries and they start getting cracks in them. And you know from eating an English muffin, if something has cracks in it, then stuff gets stuck inside of those cracks. So we don't want that to happen. That's how these blockages occur, and that could lead to MI, stroke, and a lot of other problems. So CAD, or coronary artery disease, is atherosclerosis of the coronary arteries. CHF stands for congestive heart failure. This is when the heart becomes unable to pump blood in sufficient amounts to meet the needs of the body. So the heart becomes enlarged. It's kind of like an old rubber band. It doesn't have a nice snap anymore. It's not pushing that blood through. So everything becomes congested. Blood starts backing up. If you have left-sided heart failure, you're going to start getting a lot of congestion in your lungs, which is going to make it hard to breathe. A lot of fluid starts building up there, and people just short of breath easily. They get tired easily. If you have a right-sided heart failure, you start building up in the tissues of the body. So that's when you'll start seeing really swollen ankles and feet. It's just the body can't pump that blood with enough force to move it through the body, and it just starts pooling everywhere. That is a chronic condition. There's nothing that we can do to make the heart pump the way that it used to unless the person were to get a heart transplant. So MI stands for myocardial infarction. Infarction means tissue death. So anytime you see infarct, it's tissue death. So this would be tissue death of the myocardium of the heart. And this is caused by a lack of blood flow. So when any body tissue is not getting the blood flow that it needs, it's not getting oxygen. And for us as humans, if we don't have oxygen, we're going to start to die. So if your heart's not getting the oxygen it needs, that tissue is going to start to die. So some risk factors for that would be high blood pressure. That's probably the biggest one. High cholesterol, inactive lifestyle, stress, poor eating choices. Somebody who's diabetic and they're not controlling their blood sugar, those are huge risk factors for an MI. So MI is not always going to kill someone. Sometimes part of the heart tissue dies and that person can still survive, but they might then have congestive heart failure afterwards because of the damage to the heart. So once the tissue has died, that's irreversible. We cannot bring that tissue back. So MIs, classically on TV, you see the person, they clutch their chests and they have sudden severe pain, and sometimes a heart attack or an MI does look like that, but not always. Sometimes a person just has a lot of nausea or they become very tired. That's actually the number one symptom that we see with females is just fatigue. So they just get really, really sleepy, which is a bummer because as a female, you always feel really tired. So sometimes these MIs get missed and we don't even know that the person's had an MI until we do an EKG and we see that damage. So just keep in mind, that it's not always like it is on Grey's Anatomy. Some nervous system disorders, and we're just going to touch on these really briefly because these can get really complicated. So first one I want to talk about is ALS. This stands for amyotrophic lateral sclerosis. Just know ALS. Sometimes it's also called Lou Gehrig's disease. So he kind of put a face to this disease. He was a famous baseball player that was diagnosed with ALS. ALS is rapid and progressive. There's currently no cure for it, and it does lead to death. The median age from diagnosis to death is about 39 months, so it's pretty rapid. So this person's totally healthy. 39 months later, they've died from this disease. So the only treatment we have right now is to keep that person comfortable and treat the symptoms that come along with it. So this is going to be progressive muscle weakness to the point where the diaphragm muscle becomes so weak that the person cannot breathe anymore and then they suffocate. So it's a pretty terrible disease. Then we have Parkinson's disease. So Parkinson's disease slows movements down. There's a decrease in the level of dopamine. Dopamine is required for those neuron signals to shoot from one neuron to the next, so that signal's not getting through. So this person's going to have very slow movements. They're going to have tremors. That's kind of the classic thing that you'll see. The person will just be tremoring, especially when they're trying to focus on doing something, because the brain is trying to force those neurons to fire to create that movement, and it's just not coming through because there's no dopamine there. You'll also see the person has impaired balance. They might fall a lot. They start to get this masked face where they don't necessarily show emotions in their face anymore. No smiling, no frowning. So those are some of the classic things that you'll see with Parkinson's disease. And that it is progressive, it's chronic. And a lot of times these folks end up in long-term care because they just can't care for themselves anymore. They get to the point where they can't even bring a spoon or a fork to their mouth anymore to feed themselves. So then we have traumatic brain injuries. So this can happen for any kind of trauma where there's damage to portions of the brain and it causes any kind of symptom that you could even see with a stroke. Then we have MS, muscular sclerosis. This is something that usually people get diagnosed with in their 20s or 30s. And it causes weakness. It's progressive. It usually gets worse. And what happens is the myelin sheath in the axon of the nerve starts to deteriorate, so that nerve impulse cannot be carried through. It's almost like a short in a wire. It starts, but then it gets stuck because there's nothing to carry that signal through. So this can lead to paraplegia, quadriplegia, where the person is not able to move anymore. It doesn't necessarily shorten life expectancy, but there are a lot of complications that come along with immobility that can cause them to have a shorter life expectancy. Then there's spinal cord injuries. So this can happen from trauma again, could happen, car accident, gunshots. There's a lot of different reasons why you would see spinal cord injury. That spinal cord injury can cause loss of movement and feeling in extremities. So paraplegia would be no feeling from the waist down, and quadriplegia would be from the neck down. So it just depends on where that injury is. If that person doesn't have a good support system at home, they might end up in long-term care because they're not able to care for themselves anymore. And then also with the neurological system, we talk about strokes. This is the major one. Stroke is the #1 cause of disability in the United States. So when you guys head to clinical, you will definitely be taking care of people who have had strokes. And depending on which region of the brain the stroke is affecting, you can see a whole different set of symptoms. So when somebody's having a stroke, there's a lot of different things that we might see. You might see a sudden weakness, especially if it's on one side of the body or the other. Sudden trouble speaking, which we now know is called aphasia, or understanding. Numbness or tingling, or maybe a sudden severe headache with no known cause. And this is not like a migraine headache. This is like I feel normal right now, and then 1 second later I feel like somebody hit me in the head with a baseball bat. They call it a thunderclap headache. So those are some things that you might see. And again, it depends on how serious it is and where in the brain this is happening. So there are 2 types of strokes. There's hemorrhagic, which is a bleed, kind of like a bruise in your brain, and there's ischemic. Most of the strokes that we see, probably around 80% of strokes, are ischemic strokes, and they are caused by clots or blocked blood vessels. And so that can happen anywhere in the brain, and just like we just said, if tissue is not getting oxygen, that tissue is going to start to die. And that's what happens with a stroke. Hemorrhagic stroke, the blood vessel bursts in the brain, and there's bleeding. Now your brain is enclosed inside of your skull, so there's not a whole lot of room for that bleeding to go, so it presses on the brain tissue. And you know, pressure ulcers, if you push anything for a long time, it blocks oxygen to that area and that tissue starts to die. So there's a lot to worry about there. You know, we have to either evacuate that blood as soon as we can to preserve what we have left. With an ischemic stroke, we need to, if possible, give that person some clot-busting drugs to dissolve that clot, so that we can restore blood flow to that portion of the brain before it's too late and before that tissue has died.